DNC surgery. I don't know if you can hear me, but we've been here for a while. We are going to stay here for about another hour and a half, and then they will take me back. Hello, and welcome to another video. It has been quite some time since I last posted a video on here. My last video was one that I never thought that I would have to post, and it was announcing that I lost baby number 3. I found out baby number 3 had no heartbeat on February 11th, and I posted that video on the 12th. So it is March 4th today, so it's been almost a month since everything has happened, and you guys have asked me over on Instagram how I'm feeling, how we're doing, how the whole process was. I have about 1 or 2 clips from the day of, kind of just in my hospital gown when I got there and stuff like that. So I'm just going to show you those 1 or 2 clips and then talk to you guys about how it was. So here we go. So I'm here for DNC surgery. I don't know if you can hear me, but we've been here for a while. We are going to stay here for about another hour and a half, and then they will take me back. Procedure should take about 15 minutes, and then 45 minutes for me to wake up, and that will be it. I'm okay. I'm sad, but I'm okay. I know our time will come again. And honestly, I just want it to be over with and accept it. And you know, that's all I can do. I wish it wasn't happening, but it is. And that's it. The sadness hits me in waves. Sometimes I'm okay, sometimes I'm not. Before I got here, I was fine. When I got here, I cried, and I'm okay now. So those were all the clips I took that day. That day was kind of a whirlwind. I had my DNC surgery on February the 13th. So it was like a 3-day thing. On February 11th, as you guys know, I walked into my first appointment for baby. We thought we were going to see baby for the first time, and when they did the ultrasound, we found out baby had no heartbeat. I was 11 weeks and 2 days. So the midwife scheduled me for the next day so I can see the actual OB doctor. He saw me, did an ultrasound, and he agreed with her diagnosis. I had lost baby. There was no heartbeat, and I was 11 weeks and 3 days at that point. I had what is called a missed miscarriage. So what is that? Is that my body had no symptoms. The only way that I would have figured out that I was having a miscarriage was through an ultrasound until eventually I would have had the bleeding, but it could have taken months. He said everybody's body is totally different. So that is how I found out. I went in for my ultrasound, and they had told me. He went over my options with me. I had 3 options: allowing my body to release baby naturally, taking pills to help baby, you know, pass, and then or to like break down all the tissue so I can pass baby, or doing a DNC, which was a small surgery that they went in and suctioned out the fetal and all the leftover tissue and all the things, and they would put me to sleep. I could not imagine losing baby at home. I've heard that it's tragic. I've heard, you know, you're going through it, you see it happening, and I think that I would have taken it a lot harder. I think Anthony would have taken it even harder than he did, because he did take it harder than I did, and it would have just been really hard emotionally and physically. So I went with just doing it through a DNC. I wanted it to be done over and quickly. I just wanted it over and done, kind of just like, you know, to grieve the process. So we didn't schedule a DNC. The doctor asked me, when do you want to do it? And I said, as soon as possible. He said, I totally understand. So I was on Wednesday. He said, I'll try and get you in on Thursday. I'll call the hospital and see, you know, what availability is. So I went in about 2:30. They asked me to be there at 2:30. I think they called me at 1 and said, can you come in now? So they asked me to be there around 2:30. I said, okay. I don't live that far from the hospital. I showered, you know, got dressed. I didn't know how I was gonna feel afterwards, and Anthony showered, got dressed, and then he drove with me to, he drove me to the hospital. So that is what happened. I went, they prepped me, they did the OR, and I actually didn't have surgery until about 6:30, I want to say. So Anthony went and he got something to eat, and then he came back and sat with me until it was time to, roll me into the OR. About 4:30, my doctor came, spoke to me, asked me how I was feeling, told me that he had a C-section to do, and then I was after that. I didn't get rolled into OR until about 6:30. The anesthesiologist and his assistants came and spoke to me, kind of told me what was going to happen. They were going to, put something in my IV. They call it a cocktail, and, it was going to help me relax. And then they would put a tube on, down my throat to kind of just monitor my oxygen and all that stuff. So a little bit after that, they rolled me in. They asked me if I was nervous, and I said yes. I'm not really nervous for the surgery. I'm nervous about the anesthesia. I was nervous about whether I would wake up. I wouldn't, nervous about how my body would react. I had never been put to sleep for anything. I've never had surgery other than my 2 C-sections, and they don't put you to sleep for that. They only put, local anesthesia. So I had never had general anesthesia. So when I told them that I was nervous, he went ahead and prescribed me my cocktail, as they call it. And they were like, no worries, in 30 seconds, you won't remember any of this. Clearly, I remember everything they said, so I do remember it. I don't know if people don't remember it. And then they rolled me, they took me away. I was tearing up. I kind of like cried a little bit. I didn't want Anthony to see me, so I was like hiding it. He said bye to me, and then they rolled me into the OR. When they rolled me into the OR, they had like these two little light, these two light things, but they hadn't turned them on yet. And they were like, are you okay? I said yes. And they said, we're just waiting on the anesthesiologist and on the doctor, and we'll get started. The last thing I remember hearing was my anesthesiologist just saying, I'm here. And then after that, I woke up and I was in the recovery room. So Anthony said it was about 45 minutes, but the surgery is actually only about 15 minutes. But of course, my doctor had to, put everything in the computer, make notes, prescribe me all the, medications and stuff like that. So by the time he went out and spoke to Anthony again, it was about 45 minutes. And that was that. We came home, he bought me soup from, just like the cup noodle soup from Walgreens, and he made them for me. I had them. I bought a pack of saltine crackers, and I cannot stop eating them since. And then I fell asleep. I woke up the next day normal, feeling normal as can be. I just felt like, normal until about afternoon. I think the afternoons were always really hard for me for the first like 5 days. My body was in so much pain. I would like cramp up, and I won't say so much pain. I was like sore, like I had just worked out and I was sore. So that's what it was. But the soreness was strong. So I would just sit a lot. I obviously wanted to be involved with the girls, so I picked them up maybe when I shouldn't have and stuff like that. But I was always on my feet because I hate laying down and doing nothing. I can be like completely super tired, and I hate feeling lazy. So I didn't actually like rest as I should have, but I was fine. I had minor bleeding. I did not have a whole lot of bleeding, and it was like off and on, which the doctor said was fine. It was normal, and that was it. Other than soreness, I had minor cramping. It wasn't like a whole lot of cramping, and when I did, it wasn't like period cramps. It was like uterus contractions. My uterus was going back to normal, so there were uterus contractions, kind of like when you deliver and you breastfeed, your uterus hurts because you're contracting and it's going back into its position. So it was those kind of contractions. I had my follow-up. Yes, mommy? Yes? Sorry, Ali was calling me. But what was I saying? I went to my follow-up appointment last week, and everything was fine. He said everything's back to normal. I can return to my regular activities. For 2 weeks, I wasn't able to take baths, get in jacuzzis, public pools, exercise, and things like that. But now I'm back to normal. I wasn't allowed to have sex, but now I can do, you know, everything that I was doing previous to my surgery. So that is that. He did recommend for me to wait 2 months before I tried getting pregnant again. He said that is my safe bet, but he did tell me to start taking prenatals from now, so that if I did get pregnant, my body had everything that I needed. So I do have to buy prenatals just in case I get pregnant. I really don't want this to happen again. So hopefully the prenatals will help me carry my baby the full term whenever God thinks it's right for me. So that is the plan, to take prenatals, and then whenever it happens, it will happen. I'm not going to actively try to have a baby. I think for me, it would consume me, and that's all I would think about, and it would become a job more than it being fun. So I'm just going to continue, you know, we'll do it when we do it, and if it happens, it happens. And I've never actually planned a baby, you know, on ovulation and all of that stuff. I've just gotten pregnant by the grace of God. So that is that. I think that are the only updates that I have, but I'm doing okay as I can be. Some days I'm fine and I'm okay and I'm happy, and then other days, you know, I'm hurting and I wonder why, and I just wish that I can, you know, I would have carried the baby, or that I would be, you know, be carrying baby now. I would be 14 weeks or about 15 weeks. I would know the gender, and you know, but I do feel like baby has been with me these past couple of weeks, and I've seen signs and stuff, and I'll share those things with you guys at a later date. But you know, everything happens for a reason. We are as okay as we can be. I'm very thankful for the 2 little girls that I do have and carried full term without a problem. So you know, a lot of women, like I said before, wish they could be moms, and I am one. So I'm grateful, and I've learned to be even more grateful through the process. But obviously we hurt as parents, because losing a baby, however it is never easy. So that is where we're at, but we're doing okay. Lots of positive things happening. I guess not lots, but yeah, lots of positive things happening. You know, our life is going in the right direction, and I'm excited to see what happens in 2020 and forward. So that is that. Thank you guys for always checking in on me and seeing how I'm doing, and you know, asking me questions and just stuff, you know, all the stuff. You guys are the best. So if you're not following me on Instagram, go ahead and follow me on Instagram. I'm there all the time and talk to you guys all the time. So I'll see you guys in my next video.